you talked about the elderly in the International District earlier. Could you tell me about some of the discrepancies in the treatment of Asian elderly versus the white elderly in the community?
Well, services. First and foremost, the services weren't being provided to them in a culturally appropriate manner. For example, if you grew up, let's say if you were a white person and you grew up eating basic American food, then all of a sudden you got put into a nursing home, and that nursing home only served rice and so forth, and served fish in such a way that you weren't used to having, and teriyaki and all these raw fish. And you probably say, God, that's the worst thing in the world for my grandfather to have. He'd never had that food. Well, it was the same thing with the Asian Americans when they were put into, unfortunately, into retirement homes and so forth like that, or in hospitals, and they got food and so forth that they were not, it was something that they weren't used to eating. And so they didn't eat. And so what normally happens if you don't eat, you get worse in terms of getting sick and so forth like that. So the healthcare wasn't culturally sensitive at all. And that it goes beyond the food, but food is something that you basically have to have. But then you start looking in terms of just the healthcare professionals and the lack of bilingual healthcare professionals and so forth. So when they came in trying to talk about what was wrong with them, both parties got frustrated. The doctors couldn't understand them, and then the patient couldn't tell them what was wrong. But who suffered the most? The patient. The doctors didn't take the one step further and say, well, I need to go get an interpreter and so forth. They just simply got frustrated. That's why as we looked at the issues in the early days, Asians and so forth, and especially within the University of Washington, the Asian Student Coalition, we started looking at where we needed to be having individuals start measuring it. And one area was in healthcare. The other was in working with the elderly. The other was in the issue of working within the communities and going through places such as the School of Social Work. So at that time, you see a whole big influx of Asian Americans started going into your MSW programs and becoming doctors, becoming dentists, and so forth. We felt that if we wanted to help serve our community, we could do it by becoming professionals in the field. And consequently, a lot of those early activists became doctors. A lot of them became nurses. A lot of them became administrators within hospitals and other social service agencies. And you see that throughout the community.